Hi there, and welcome to this month's podcast, which is all about the Perfect 10. Most of you should have heard about Perfect 10 by now. It's an initiative that we're running across both hospitals at the moment, across a 10-day period. The idea of Perfect 10 is 10 days to make a lasting difference, and we've launched this to try and tackle the issues around patient flow that we've been experiencing for some time now. Our hospitals have been constantly over capacity recently, and so we have identified that something needs to be done. We believe that if everyone commits to working together to remove barriers to patient flow, we can make a real and lasting improvement to patients' experience, care quality, safety, and importantly, staff morale. So during these 10 days, we are focusing all available resources on achieving this. Thank you to all of you for committing to this so far. We're seeing enthusiastic engagement throughout the organisation and lots of drive to do things differently. Each day we're looking closely at all of the patients we have in our beds, and we're looking at what needs to be done to improve patient flow. So today I'm here in the Bed Bureau, which is where our daily bed meetings take place. We've been putting together bulletins every day to keep you up to date about how the Perfect 10 is going, so please do keep checking the intranet homepage and ensure that you pass the information on to your colleagues. So here's the story so far. We are now on day 4, almost halfway through, and we have made some great progress. When we started this on Monday morning, we had no free beds at all at either hospital, with escalated beds at both Preston and Chorley and a large number of patients in the wrong beds. Patients had to sleep overnight in the emergency departments, and our theatre lists started late, with many of these delays related to bed availability. We also had a large number of patients who were medically fit to be discharged, but the discharge was delayed for various reasons. So this was a good time to launch Perfect 10. The hospitals were and continue to be extremely busy, so our ward liaison officer, ward staff and a whole range of other staff have been working really hard to identify a number of barriers and potential delays. The issues are being reported to Silver Command, who then work to resolve it. So far, Perfect 10 has helped us to pick up on a couple of issues that are now being resolved. We realised that not every ward has a daily morning bed round, and there's a lot of variation in how each board round works. So we think that standardising this practice could significantly improve patient flow and enable earlier decision making. So we want you to focus on these 5 daily actions during your board rounds. We also really need you to focus on discharging patients as early in the day as we possibly can. And we're aiming for at least 40% of discharges to take place by noon. Therefore, you need to make arrangements the day before discharge for as many patients as possible. Ask families to bring clothes in advance so that patients can go to the discharge lounge, book transport the day before, and arrange prescriptions to be ready to take home. We also need to make full use of the Beechwood and Spiral units and be aware that patients who need intravenous antibiotics can receive their treatment in these units or at home. It's critical that medical outliers are identified on the McKesson bed management system in real time so that they can be reviewed by the right team promptly. We also want you to make sure that all patients have an estimated date of discharge recorded on McKesson. If you identify any issues to patient flow that you can't resolve promptly, please contact Silver Command for support. So at this stage, day 4, we have already made some really great progress, and the actions are having a really good impact. So far, we have managed to de-escalate day case, and we actually have some free inpatient beds, which is a dramatic improvement. There have been many fewer breaches of the emergency department for our target, and we're seeing more consultant ward rounds, and more are now happening earlier in the day, which means more patients are being discharged earlier in the day. The key issue that has been highlighted every day so far is that theatres are starting late. Staff have been asked to reinforce the required protocols and standards, but we really need to resolve this issue because theatres are routinely starting late for non-clinical or hospital capacity reasons, and this isn't acceptable. It's great to see the improvements that are already being made, and I want to say a big thank you to all of you who are already taking action to make a difference. There are loads of fantastic examples. Several wards, including Plastics, MAU, Ward 20, are having extra board rounds, and we're looking at the structure of board rounds to ensure that they're more efficient and productive. Clinicians should follow these 3 stages during their board rounds. This will make sure we're prioritising patients with the most need and ensuring there are no delays in discharging patients who are fit to leave. The phlebotomy team are providing extra support to wards. In medicine, the ward huddle has been brought forward from 12:30 to 10 a.m. to enable staff to discharge patients earlier in the day and release time to start planning tomorrow's discharges today. And the discharge team has donned their pyjamas to highlight to patients and visitors that they need to bring outdoor clothes to hospital in advance of being discharged. At Preston, pharmacy porter runs are now taking place every half hour from 10 a.m. So medicines are being delivered to wards regularly throughout the day so that nursing staff don't need to come to pharmacy unless medicines are needed more urgently. And because they now have capacity, the surgical and medical assessment units are now accepting patients from the emergency department immediately after clinician handover has taken place without the need to phone the units, which is speeding up the transfer process. There are loads more brilliant examples of what you're doing to make a difference. Check out the Perfect 10 bulletins on the intranet to read more. We want all of you to make a pledge about what you will do to make a lasting difference. To make a real difference, we need to commit to maintaining the positive action we've taken and embed these improvements for the future. There are loads more brilliant examples of what you're doing to make a difference. Check out the Perfect 10 bulletins on the intranet to read more. We want all of you to make a pledge about what you will do to make a lasting difference. To make a real difference, we need to commit to maintaining the positive action we've taken and embed these improvements for the future. I pledge to support you when you challenge the way that we work. What is your pledge? Please go to the homepage of the intranet to submit your pledge, and together we can really make a lasting difference for our patients and ourselves. Please also tell us what you're doing in your area to make a difference by emailing the address below. Thank you for watching, and please do keep reading the Perfect 10 updates. Today, I'm dressed in my uniform to go back to the floor with the medical students this afternoon, so look out for the blog and I shall tell you how I got on.